I'd been as a board member on our tribal health board for a number of years, had seen a gap that we weren't being able to address over that time, and the gap was really working with community at grassroots to engage in decision making around their own health. And so this was an area of interest for me. I could see that it may have the potential for communities to engage on a higher level than they had in the past, perhaps. And so, that's kind of what encouraged me to apply for the fellowship. One fellow who was involved in methamphetamine and developing a project to address that in Aboriginal communities. But using cultural frameworks, which here in New Zealand we seem to be very much involved in drawing on cultural frameworks that come from our ancestors, which we find are relevant just today as they ever were. And so this fellow travelled here to the Tide AFSE. The Tribal Health Board that I'm on also run a methamphetamine project, or I suppose you could call it a program, Te Herenga Matua. And that was a really good example for her to look at, to see how cultural frameworks are being implemented in the workplace by staff and what kind of effects it was having. I don't believe that I can build their capacity. I believe that everyone has capacity, and all as what we call ourselves change agents, or at the time it was, I think it was population health officers, but people who become involved in this work do call themselves change agents. It's not about building the capacity in others. They already have it latent in them, and understanding that, I think, is really important. A lot of capacity is built when people start to engage and start to dialogue and start to consult with one another about what their priorities are, and then plan action from it. And through those processes, the capacity is built, and it's inherent within all of us. Releasing potential, or perhaps thinking of it in terms of walking alongside someone to realise their own potential, is probably how I see things.